Hi, Mr. Fulmer. How are you doing today?
Good, how are you doing?
Good. My name is Amelia and I'm a student physical therapist. I'm going to be conducting your interview today.
Nice to meet you, Amelia.
Nice to meet you too. Let's just start off with asking you what brought you into the clinic today.
I hurt my neck this, this week sometime, kind of on the left side here. It's just been bugging me.
Okay. Have you ever been to this clinic before?
No, I haven't. My daughter had an ACL repair last year and she was in.
Oh, okay. So are you from this area? Do you live close by?
Yeah, we do. We just over here in Pleasant Grove.
Oh,
so
cool.
Not too far.
Yeah, I went to Pleasant Grove High School.
Oh, very good.
Yeah.
So
where
my kids go too.
Where about Pleasant Grove do you live?
We live kind of over on the west side by the temple.
Okay.
Kind of on the AF border, but we're in Pleasant Grove.
Cool. Very familiar with that area. That's really cool. So you said your neck pain started sometime this week. Do you remember a certain time it started?
Yeah, I don't know, maybe about Sunday-ish, somewhere back then it started, and then it's gotten a little worse as the week's gone by.
Okay. Do you remember if there was a certain motion or activity that you were doing when it started?
I don't know what caused it. I don't know if I slept on it wrong, or maybe I, just twisted wrong or something, but it's just been sore all week.
Okay. And remind me again where you're feeling the most pain.
Kind of right from the base of my skull back here to the top of my shoulder blade, and it, right through here.
And is it the majority on your left side?
Yeah,
or
it's on the left side. The right doesn't bug me. It's all
Okay.
left.
Are there any certain movement or activities that make it worse or make the pain?
Yeah, looking over my shoulder hurts.
Okay.
Like when I'm driving, if I need to look over my shoulder, or sometimes if I kind of twist just right with my head, it hurts, but it's mainly rotation of my head.
Okay. I was looking at your patient questionnaire that we had you fill out, and you wrote down that you are feeling currently a pain level of 5.
Mm-hmm.
Okay.
That's about right.
And on average, it's usually a 5?
Yeah, it's been a little bit worse at times, a little better at times, but that's kind of about where it is normally.
Okay. At its worst, what would you say it's at?
Maybe 7 or 8.
Okay. And does it ever get below a 5?
Yeah, when it feels the best, maybe 3.
Okay. And what makes it feel the best?
Like today, I ran, and when I was running, it was sore when I started. Then as I kind of ran and got warmed up real good, I felt a little better. Then when I got home in the shower, hot shower helped it feel a little better.
Okay. So a little bit of motion in the neck and a warm shower make it feel better.
Mm-hmm.
Okay. You haven't seen a doctor about your neck pain, have you?
No.
Okay.
Nope.
On your questionnaire, I see you're taking Verapamil. Do you mind if I ask what that's for?
Yeah, I have a borderline high blood pressure, so my doctor started me on that just a few months ago.
Okay. Do you feel like that's managing your blood pressure okay, or
Yep.
is it working?
Yeah, it is. I test it a couple times a week, and it's been right in line with where he wants it to be. So.
Perfect. And you're not taking any other medications over the counter or anything for your neck?
No.
Okay.
Not yet. I haven't taken any yet, but I probably should.
Okay. I do also see on here that you have family history of high blood pressure, but also diabetes, heart disease, and stroke. Do you know who in your family had those things?
Yeah, my dad had a stroke late in his 70s. He also had a coronary, he had a heart attack, so he had coronary artery bypass graft done. And then he had a sister that had a stroke, and then one of my older brothers had a stroke not too long ago.
Oh, wow, okay. So pretty closely related.
Yeah. On my dad's side of the family, for sure.
Have you seen a doctor about these? Has he checked you on these things?
Yeah, I go in for a yearly physical, so my doctor kind of monitors all those things, but so far so good, except for the high, little elevated blood pressure.
Okay, but you're taking the medication. It seems to be working.
Yep.
I also see on here that you've had prior surgeries. Do you want to expand on that a little bit more?
I had an eye surgery when I was in 4th grade,
Okay.
and then I had a cataract in that same eye, my right eye, 4 or 5 years ago, and then I had a shoulder. I dislocated my shoulder several times, so I had a rotator cuff repair in 1996.
Okay, so those are all quite a while ago, so probably not related. Which is good.
Yep.
Okay. Let's talk a little bit about your living situation. I know you mentioned you had a daughter. Do you live with your family?
Yep.
Here in
My
Pleasant
wife
Grove?
and I, and we have a 1st grader and a couple college students that live with us.
Wow, quite the range.
Yeah, we have my youngest, he's 11 years younger than his next sibling, my daughter that just graduated from high school. So she graduated high school, and he started 1st grade this year. So
Wow, that's crazy. That sounds so fun.
yeah,
Probably.
we're starting over.
Yeah, keeps you on your toes.
Yep.
Oh, well, I know you mentioned running, and you have a younger kid at home. Is there stuff you like to do outside of that with that is limited with your neck pain?
We swim, we'll hike or go do stuff out. We ride Razor outside. We like to do outside stuff. My little boy's playing soccer, so he's just started this season.
Oh, fun.
So
I played soccer too.
oh,
It's the best
nice.
sport.
Yeah, we love soccer.
Have you noticed any limitation with any of those activities with the neck pain other than running?
I haven't done a whole lot this week just because it's been sore.
Okay.
So it's limited me just because I haven't really wanted to do much.
Yeah.
I went out walking a couple times and then I ran today for the first time. But
Okay. So overall, you seem like you're pretty active. So what would you say your overall health is?
it's been good.
Pretty good,
Yeah.
other than the high blood pressure, which seems to be managed.
I feel like I'm in pretty decent shape. Not great, but not bad. So
Yeah. But with this neck pain, your activity levels probably dropped a little bit. Sounds like you've been walking rather than running.
Yes.
Okay. Well, just a couple more questions. Have you noticed any rashes or skin abnormalities?
No, I haven't.
Okay. Have you noticed any numbness or tingling anywhere?
Nope.
Is there pain anywhere other than in your neck?
No, it's pretty just right there.
Okay. And then we talked about your high blood pressure already, but have you noticed any circulatory problems? Okay, good. I know you were pretty active and you have a young kid at home again, but is there any other goals you're looking to get out of with physical therapy?
I just want to feel better and maybe have some things that I could try to do at home, stretches. I don't know exactly how to stretch that area in my neck,
Okay.
but maybe some stretches or some things I could do to help calm it down when it flares up.
Yeah, we'll definitely talk about some things that we can have you do at home. Just to summarize, to make sure that I'm on the same page as you, you're feeling pain from like the base of your skull to the top of your shoulder blade on your left side of your neck. Rotation seems to really irritate it. A lot of outdoor running activity seems to irritate it. But after a little bit of running and a hot shower, your pain decreases quite a bit.
Yep.
Your current pain level is around a 5, and that's the average pain you usually feel. Okay. Let's see. You're in pretty good health overall, pretty active. Your activity level has been limited this week due to the neck pain, but other than your high blood pressure, you're in great health. You just want to be able to get the pain to go away, find some stretches to do at home, and just get back to doing your activities. Does that sound about right?
Yeah, you got it.
Okay. Well, the next thing I want to do is we'll go over into the gym. We'll do some motions and exercise or some tests to see where you're at, and then we'll be able to put together a plan to get you feeling better. I can definitely get some stuff to do with you here at the clinic with me, and then I can give you some stuff to do at home as well to hopefully help get your pain get going away. And I think we can get you back to your normal activity here pretty quick. So
No,
if
good.
that sounds all right.
Yeah, that sounds great.
Okay, well, let's head over to the gym and we'll continue over there.
All right, thanks.